Today, I'm going to be giving you some insights about the Ebola virus. You may have been hearing that there is another outbreak in the Democratic Republic of Congo, and this is one of the largest outbreaks. My belief is that the more we understand, the less afraid we can be. And as I think back to severe COVID when it was going around in 2020, what made me feel far more relaxed was when I had an understanding about the immune mechanism with regards to severe COVID. I remember telling colleagues in early 2020, listen, if I ever get sick, I want you to give me this. High doses, I was talking about steroids at the time, immediately. And that was my thought. And that was what I wanted to do. But that came about largely because I had a good understanding of the pathophysiology, because subsequently in June, they confirmed through the recovery trial about steroids. So this is what I mean, is that when you understand the disease, you feel less anxious about it, and it helps you to be able to cope with the challenges. I'm going to be sharing some parallels with regards to COVID, where a lot of my research has been, and looking at what happened with Ebola, the pathogenesis of Ebola virus disease. This is a paper that was published in 2017, and this was done in the US and New Mexico. And they were just talking about the Ebola virus, where it was, and the pathophysiology. And when I looked at it, I thought there are some important points here that I think could be relevant in terms of understanding what really is going on. And when we look at the history with regards to Ebola, 1976 in Zaire, now the Democratic Republic of Congo, they found this virus appearing and it terrified people. And it was a new viral hemorrhagic fever. This is very important because everybody perceives Ebola as a hemorrhagic or a bleeding disease. And this is true, but it's more complicated than that. And the hemorrhage, certainly similar to dengue hemorrhagic fever, which is 1953, we're seeing all of these patterns emerging. But this is part of the problem with regards to Ebola. And I'll be taking you through what the paper has said in terms of the characteristics of it. Just some basic information with regards to virology. Um, Looking at it's not similar to any other virus that you have floating around. The closest may be the Marburg virus, but it's a filoviridae, which is, I guess, one of the more unusual viruses that we will come across. And critically, it's an RNA virus, similar to COVID. And this is why I think it's important to look at the parallels from the diseases that we know in terms of what is going on. Here is an image from the paper looking at the characteristics of the virus and the various proteins that are involved, the GP protein, and this would be similar to a spike protein. And then you have proteins on the inside of the virus. And this red one, VP30, would be similar to COVID, more like a nuclear capsid protein with regards to the RNA. And so the viruses, remember, a virus can't exist on its own. It has to infect a cell in order for it to make progeny, to produce more viruses. And so it uses these tools to get inside the cell, take over the machinery, and then it will make many more viral particles, which can then infect other cells. And so this is the basis with regards to Ebola. And when we look at where in the world Ebola is primarily located, you can see here, this is Africa, this is South Sudan, this is the Democratic Republic of Congo. And you can see these red spots here representing when 1976, 1977, Gabon had some cases as well, Sierra Leone, and these are all the characteristics. And there are only a few cases that occurred outside of Africa. And so there are some characteristics about this virus that make it very difficult to become a pandemic. And this is important to understand, especially because it's not naturally in humans. And when we look at this here with regards to the viral reservoir, they have tried to figure it out for over 40 years, but it suggests certain animal species, bats, squirrels, mice, rats, shrews. There's an overlap with regards to these animal species. And as I said, it's not normally in humans. And this is part of the reason why it's so difficult for this to become a pandemic. And this is why when we're hearing all this pandemic thing going around, there are certain characteristics that have to occur in a virus for it to become easily a pandemic. Ebola is not really one of those. So it doesn't happen very often, but I want to take you through some of the characteristics that happen with it. And as I said, overlap this with regards to some of the studies with COVID. And as we can see here, these are some of the animal hosts. The virus can enter through the eyes, causing inflammation there. It can cause inflammation in the brain, can enter through cuts as well. It can be ingested because there's a lot of diarrhea, vomiting, so you can get exposure to bodily fluids, and it can cause damage in the lungs, the kidneys, the pancreas. Critically, the secretory diarrhea is a big part of it. And what it seems to do is infect immune cells, and then the immune cells will traffic it all over the body into different parts of the body. And then this is part of the journey that the virus has. So you can see that it has multiple impacts on different parts of the body. But when it comes to causing severe disease, what you have to look at very carefully is that it will infect hepatocytes, that's in the liver, the spleen, and the lymph nodes. It damages the lymphocytes. It can damage the kidneys. And critically, the blood vessels. It can cause clots, and it causes increased vascular permeability. Now, this is very important because part of the reason why people die is because the blood vessels lose a lot of fluid and the person will go into shock. Shock meaning that they don't, it's kind of like they've bled. Bleeding is part of Ebola, but even beyond that, they lose a lot of fluids, and then this can then go on to cause quite significant damage to the body. Now, here we come to what I think is the most important bit of this paper when I think about what and how different approaches can be done. When you look at what it then does, is that it inhibits interferon. Now, this is very important. The main mechanism as to how this virus causes problems is that it inhibits interferon. And it has a number of mechanisms that it uses with proteins to hide and to block interferon. Now, before we go on, it's very important to understand this interferon principle. Interferon is one of the most important cytokines that your body produces to let everybody know there's a virus or in some bacteria. The cells that are infected switch on the fire alarm. The noise goes out, flashing lights, cells all over the body, and the immune system goes, okay, we've got a virus. The cells will then shut down their protein making machinery, switch off all their systems so that even if they get infected, it's not easy for the virus to then continue to replicate. And so interferon is one of the most important immune activities that your body does when you have exposure to a virus. Now, this was very important in terms of COVID and severe COVID. And when I had this in my COVID course, the advanced courses, this is one of the slides. Looking at this is SARS-CoV-2 infecting a cell or a virus. And what normally happens is that interferon is produced. The interferon goes from the cell. It goes to the cells close by. They then put up their barriers and switch off their protein making machinery. It tells any cell that is already infected to die, and that way they can't make more virus. And then it calls all the immune cells to target that area. And this interferon system is also the reason why severe COVID occurred, because if people didn't have good interferon protection, what would then happen is the virus would continue to spread. And by the time they triggered an interferon response, it was almost too late and too strong. So, what we call a delayed interferon mechanism. This is really important with regards to COVID. And what's very interesting is when I looked at Ebola, it was a very similar pattern. A delayed interferon response with a associated cytokine storm, a hyperactive immune response that then occurs afterwards. And this seems to be a critical part of what then leads to the pathology. So when we look at the paper here, again, coming back, although thousands of people have died, few autopsies and biopsies have been performed. And they have been looking at specific bits of damage to the mucous membranes, the linings in the mouth, and so on, or in the GI tract, hemorrhage in the gastrointestinal tract, congestion of abdominal organs. All of these things happen with regards to Ebola, Ebola infection. Now, when we look at the timeline, and this is where I said that it's very similar in terms of COVID. When we look at the timeline that happens with regards to this illness, look carefully. You have here, when we look at the paper, and again, just in case you're joining us here, this is an overview of Ebola virus, and it was published in 2017. So here is the incubation period where someone was exposed, and they would have now circulating virus in their bloodstream. But because the virus has suppressed the interferon response, there is no response as yet. Then they start to have symptoms like fever. Now, once you start to have the fever and neuromuscular weakness, that indicates the interferon has kicked in. And this is now the first week of illness. Well, it's technically the second week, because in the first week, there are oftentimes no symptoms. Then they start with the fever. Now, at this point, you know interferon is being produced. But similar to COVID, I suspect that this is a delayed interferon response, because quite quickly after, you then start to have damage to the liver, coagulation problems, diarrhea, rash. Now, look carefully at this. At this point, this black square represents viral RNA. So the viral RNA would have been rising. So the amount of virus in the bloodstream, it hits the peak. This is the indication as to when interferon kicks in. So they have the fever. And within a few days, you start to see the viral load fall right down. Okay? What this seems to be indicating is that the ongoing damage of the hepatic injury, the coagulopathy, respiratory failure, renal failure are not directly because of the virus, but they seem to be connected to the immune response around the virus. Now, I can't emphasize how important this is. And this is why I was saying that, in effect, like COVID, it's an immune vascular disease, a hyperimmune response to the virus, almost behaving like a cytokine storm. And once this kicks in and starts occurring, it's very difficult for the body to stop it. And then you have this ongoing mechanism where you start to have damage to the liver, the gastrointestinal tract. You start to have respiratory failure because they're leaking fluid out of the blood vessels. They're making clots. The kidneys fail. They start to have inflammation around the brain. All this time, the viral levels are falling because the immune system has kicked in. Now, remember, let's just go over this again because this is a very important point. I'm going to take you back to understand what happens with regards to interferon. So, taking you back to the interferon concept, here you have effectively the virus infected the cells, there was no interferon. Okay? The virus replicated, continued to replicate, infected multiple other cells, there was no interferon. Then there comes a point where the immune system suddenly realizes, oh my goodness, there's virus everywhere, and it produces a massive interferon response, which then drives the immune system into overdrive. And when I was using an analogy with regards to what happened in COVID and severe COVID, I imagine that terrorists were coming through the border. The Border Patrol didn't respond. The terrorists then go into the city, and the terrorists then start shooting randomly, and the army is called in to clear this up. The army is coming with tanks, with planes, and they're just trying to take out the terrorists. They are not looking at the damage that can occur to structures, people, and otherwise around. And this is in effect what I think is the primary pattern that occurs both with COVID and it seems with Ebola as well. Because when you look at the characteristics of the lab findings, early illness, there is low lymphocyte count, low neutrophil count. The hemoglobin goes up because they have lost so much fluid from their bloodstream. It represents liver damage. And you can see by this point at the peak illness, their kidneys are failing and they are septic, and critically they are clotting. Well, the thrombocytosis, they're rebuilding. All of this is happening in the body. Now, it's important to note that if you have the right supportive treatment, fluids to rehydrate and to support somebody, say, on a high dependency unit or intensive care unit, I suspect that in countries that have strong medical facilities, not many people will necessarily die if they can support them through the infection. What happens in Africa, if you have limited access to health resources, then suddenly every one of these infections can become life-threatening. And so this is why I'm saying, once you understand what is going on, and you understand the immune response, and you understand the fact that fluid is leaking out, if you replace this, support the patient through it, pretty good chance that they won't go on to have severe disease, or they will survive the severe disease. And one of the critical things that happens with Ebola is the damage to the intestinal tract. There's a lot of inflammation, then there is ulceration, and then there is bleeding. And this is one of the ways that patients die, because once they start bleeding internally, there is no easy way to stop it. And that's the bit that no matter where you are, if you have the hemorrhagic portion where there's inflammation and there's damage to the lining inside the intestines, especially the colon and the duodenum, and they start bleeding internally, that is very hard to stop without surgical intervention in a patient who is very sick, and that can increase mortality. But here is the important point. We don't have much insight into this because we're limited with regards to the research that has already been done. But because the gastrointestinal tract is so important, one of the points that I keep on making to people, and this is important for COVID as well, where you remember the Delta variant and all the GI symptoms that people had. And when we are looking at the research, it is indicating that inflammation of the gastrointestinal tract seems to be absolutely central for severe COVID and for Ebola. Please take care of your gut. Take care of your intestine. This is probably the most important point that I can make for people, is that if you are going to try and address some of the longer term exposures and challenges, you have got to address the intestine. And this is why so much of my work has been around helping people to understand, how do you help the intestine and how do you work to get it better? Because if you don't, many conditions are likely to make sure that you are at higher risk. The final point I want to make is to do with when they look at prevention of Ebola virus disease. At the moment, they're focused on vaccines. My only concern with regards to that is that they are planning to use vaccines on a cohort who already have resource depletion. Unless you're pretty sure that this blocks infection and really works, they would probably benefit more in Africa by supporting their healthcare infrastructure, so that if people get sick, you can then help them to get better and they have access to hospital facilities. That is a critical part. The other thought that I had, which I explored a little bit, was about interferon. Now, we know that in the early phase of the disease, interferon suppression is the reason that the virus is able to continue replicating so avidly throughout the body. And just a reminder as to what you see here. In this early phase, for almost the first week and 2 days, there are no symptoms, and the virus is just continuing to replicate in the bloodstream. When it hits its peak, that's when you start to have all of the immune related symptoms. My point is that because we know the exposure, unlike with COVID, where we couldn't easily know, why would they not give interferon in this phase? If you know someone is exposed, they've been around a family member or they're working in a hospital, by giving interferon, you could potentially have an impact. The other thing is an antiviral, but so far, most of the antivirals have not been that effective. Actually, I think remdesivir is one that was used with Ebola and was struggling to work effectively. And this indicates that an antiviral may struggle to manage the ongoing replication of the virus, and you may. So I was then looking at, okay, if people don't have drugs, what they do? One, as I said, fix your gut. Two, make sure vitamin D is addressed. Make sure you're not deficient. Some people will talk about zinc because viruses need zinc in order to continue the infection cycle and the replication cycle. And the immune system is far more effective with it. And so that can help. Vitamin C, in theory, if somebody's exposed, because anything that reduces the viremia should, in theory, help to reduce the severity of the disease. And this is the principle not just for Ebola, it also works for COVID. Things like humming will not work because the entry point for Ebola is not the upper airways. It's most likely oral and or through the eyes or through the skin. And so therefore, things like humming that work in terms of building the upper airway immunity through nitric oxide are less effective or not effective at all. My belief is that when we study carefully as to how a disease causes severe pathology, we then have the opportunity to try and mitigate it and save lives. One of my favorites in terms of COVID would be steroids. However, I can see the problem straight away when I look at this pattern, is that at this point here, when the virus is continuing to replicate, if you gave steroids, you'd suppress the immune system further and it would continue to replicate more. Even though the immune pathology is what drives it, I am not sure if steroids at this point in this disease would necessarily help. And this is why I said understanding the pathophysiology is so important to try and see if we can find ways to mitigate any disease. The principles remain simple. Everybody has a responsibility to understand as much as they can. Here we see that this Ebola virus causes damage to the blood vessels, primarily through immune mechanisms, leaking fluid out. It damages the lining of the gastrointestinal tract, which causes fluid leakage, diarrhea, vomiting, and then bleeding, and it causes immune dysfunction. This is a serious virus, but the characteristics of it make it unlikely to be a pandemic. As I said, my expectation, based on the priming and the discussions that have been happening, it seems inevitable that we will face another one. And I'm not saying this because I think that something will happen on its own. I just suspect that things will happen because they, how do I say this without getting censored? You should know what I mean. And the point is that the better prepared everyone is to try and find ways to mitigate what would be an absolute disaster, the better off we all will be. Thank you very much for listening. As usual, look in the description below. There are lots of information that you can learn from. And I look forward to being able to share more information with you in the near future. Have a great evening.